We have, as we announced earlier, August and a glittering awards presentation ceremony later on this evening. And we have our chief guest who's just arrived, and he's none other than Mr. Ajit Singh. And introducing Ajit Singh to this audience will be like introducing Sunil Gavaskar to the world of cricket. So, Mr. Ajit Singh, thank you very much for joining in, and it's a great pleasure to have you with us, great honor. And we'll have you later on this evening to do the honors for the awards, and we'll hear you speak also later on this evening. Thank you very much, sir, for being with us. Moving on, Dr. Kodkani in that panel discussion did mention that we are at the forefront in orthopedics in India. Taking a cue from that, we continue in that segment. And our next speaker for the afternoon is Dr. Dinshaw Pardiwala, Director, Arthroscopy, Sports Orthopaedics and Shoulder Service Head, Center of Sports Medicine, Kokilaben, Dhirubhai, Ambani Hospital. Dr. Pardiwala will speak to us on healthcare innovations in sports medicine, strategies to ensure quick and safe return to play after injury in elite athletes. Dr. Pardiwala is an orthopedic surgeon par excellence, specializing in shoulder replacement and sports injuries surgeries. His expertise lies in Bankart and rotator cuff repairs and arthroscopic ACL and PCL knee repair surgeries. Currently associated with KDAH, as I said earlier, Dr. Pardiwala serves as Director of Department of Arthroscopy, Sports Medicine and Shoulder Service, and he has performed over 1,600 shoulder and sports-related surgeries. He has handled over 4,000 arthroscopic cases. With several firsts to his name, he performed the first reverse shoulder replacement surgery, the first navigation-guided ACL repair, and the first autologous chondrocyte stem cell transplant in India. He has been a sports physician for a number of sports organizations. It's a great honor and privilege to have him with us. Ladies and gentlemen, welcome in our midst, Dr. Dinshaw Pardiwala. Welcome, Dr. Pardiwala. Great pleasure.
So I'm going to talk on the strategies we employ to ensure a quick and safe return to sports after injury in elite athletes. At the Rio 2016 Olympics, we had one of our star athletes who was expecting a medal there, land up with an injury, a serious injury to her right knee. She had to be stretchered off. She had to be taken to the local hospital there where her knee was reduced. The local doctors, in fact, told her that it's going to be difficult for her to probably wrestle again in life. She had to be flown urgently to India. We had to do a grueling 4.5-hour surgery to repair all her ligaments and get her nerve back in order because that limb was a little paralyzed. But the gritty girl went on a week later in her cast, received her Arjuna Award, returned back to wrestling in about 6 months. At the Asian Wrestling Championship, 7 months later, got a silver medal. A year after that, at the Commonwealth Games, defeated all her opponents very easily and got the gold medal. She also got the Asian Games medal that year and is today our leading hope for a medal at the Tokyo Olympics. So you can land up with a grievous injury in sports, but we do have the means and we've got strategies now to help you get back to your original level of sports. So what are these strategies that we use? First is diagnostics. We need to know exactly what's wrong, and that's where advanced medical imaging comes into play. The second is when we know what's wrong, we need to treat it. And either we treat it with non-operative rehabilitative means, or we treat it with surgery. And if that requires surgery, then it has to be a minimally invasive sort of surgery. In certain situations, surgery is going to be too much, but then we have certain means like Ortho-Biologics, so means to ensure a faster healing and repair. And finally, in sports, I think we also need to understand biomechanics. because it's not just structure and function, it's how you use that function which ensures that you become a world beater at the end of the day. So let's see each of these different heads of innovations that we have and the advances that have taken place. At the same Olympics, we had our star badminton player land up with an injury, unfortunately, on the day that she landed there in Rio. And she had to be again flown back after a disastrous Olympics. She had to undergo surgery for this. She sprung back. In 4.5 months, she won the Malaysian Masters thereafter, went back to the Commonwealth, won the gold medal there, and has been competing very successfully for the past 3 years now. But it was not her surgery which was so dramatic. It was really the diagnostics which were dramatic. And in any sort of procedure that we do, we first need to know what we're dealing with. And it's the advanced MRIs and the PET MRIs that we have today that give us these advanced sort of imaging features in these small joints. So these are small structures, and if we need to identify what's exactly wrong with them, we need a better means of visualization. And these new machines tend to give us that. So you can see out here, that's the cartilage, that's the patella in the knee, and today our resolution of these very small, fine structures is much, much better. But we can do even further than that. We can get into the ultra structure of that. So what you'd see in a microscope is almost what you could see now on our MRIs as far as cartilage is concerned. Until lately, we had only the means on an MRI to know what is structure and not really function. But now with the newer MRI sequences that we've got, like this one, which is degeneric, we can actually know what's the collagen content in that cartilage. And in sequences like T2 mapping, we can actually know what's the proteoglycan content in that cartilage, and then predict how well that cartilage is going to behave physiologically and functionally. So diagnostics and imaging, I think, is a key part of where we are today. The second, minimally invasive arthroscopic surgery. So when a sportsman lands up with an injury, like this goalkeeper who's during one of the World Cup qualifiers landed up with a serious injury to his knee. He's from the South Asian Federation. He's the captain of a neighboring country. He lands up with an injury to the knee. If he undergoes an open surgery, the likelihood of him getting back to sports is going to be about 1.5 to 2 years. But if he undergoes an arthroscopic surgery for exactly the same thing, his return to sport is going to be about 6 to 7 months. And so that makes a dramatic difference to a sportsman, because every month of playing is critical in his short playing career. And what we have today in arthroscopic surgery is a minimally invasive access to the joint. Except for maybe a replacement or a fracture, we can probably do anything else with arthroscopic surgery. It's available for the hip, the knee, the ankle, the elbow, the shoulder, the wrist, and also certain sites which are not truly in the joint. Like in the foot, we can do it for extra articular parts too, and we call that soft tissue endoscopy. So a minimally invasive access really allows our sportsmen a quicker return to sports because of the decreased morbidity of the procedure itself. Along with minimally accessed surgery, we need to have some advanced medical devices with which we can repair these patients. So take, for example, this young boy, and this is a very popular sport now in Mumbai. So this is parkour, and it's becoming more and more popular in urban areas where you jump off buildings too. So a dangerous adventure sport. And this sport, again, is something that you're going to be prone for injuries too. And when one of our top parkour athletes lands up with an injury, and that's a severe injury, we're going to need to repair it. Now, the repair involves using devices which are extremely, extremely small, to the size of 1 millimeter or sometimes smaller. And we're working in a joint space which is at most 2 to 3 millimeters. So the devices that we have allows us to do a much better repair. And that's, I think, the second sort of innovation that's come in arthroscopic surgery and sports surgery in the past few years. An injury like this would have been certainly career-ending 20 years back. Today, a structure like this, which is the meniscus, which is the shock absorber, which used to be taken out in the past, really needs to be repaired. And to repair this, you need very fine, very strong devices, and these devices can achieve what they need to do. So you put everything back into position, you stitch it up, and once you've stitched it up, you get your anatomical congruity. You also need instruments to pass that in, and these instruments need to be extremely small. They can't break inside, because if they break inside, you're going to have a headache trying to get them out. So it's difficult, but possible to restore your anatomy. And once you've restored your anatomy, hopefully you're going to be able to restore function. So take this boy, for example. So we've repaired his meniscus, a badly shattered one. And when we go down a few months later, so that's his lateral meniscus. And we sometimes will do these procedures in stages. So in the first stage, you're going to do 2 or 3 different things, and in the second stage, you're going to do 1 or 2, because you don't want to do too much at one time and land up with a stiff joint. So that's his meniscus. And when we look at it 4 months later, when we go for his second stage, you can see that that's a healed meniscus. Now, 25 years back, we didn't even believe that menisci could heal, and therefore, these were being taken out. But if you have a high-demand athlete who needs to run, jump, and do all of these crazy stunts, he certainly can't do it without a meniscus. And today, we have the means of actually repairing these meniscus and getting these patients back to normalcy. And so when I asked him a few days back, how are you doing? He sends me this video. He's now 7 months post his surgery. He sends me this video and says, that's how well I'm doing. So he's back to training and hopefully back to his competitive sport very soon. What about patients who don't have structural problems that are so severe that they require surgery, but at the same time enough to trouble them enough that they can't perform their sport? And we had one of our star athletes just before the Asian Games, 6 weeks before the Asian Games. She had a major injury, but not so bad that she required surgery, but good enough for her not to be playing her sport. And we decided, look, it's too short a time to offer her any surgical treatment. We're going to give her an injection in the knee that's going to solve her problem, at least for now. And she went back, trained, went to the Asian Games, in fact, got a gold medal there 6 weeks after this major injury. And she was so happy with that injection that she, in fact, asked us, can you help me also with my toes? I've got 12 toes, and can you give me an injection and get rid of 1 toe on each of my feet, because I have no shoes that will fit. So sometimes you can land up with a situation where you don't really need a surgery, but you can get away with an injection. And these 2, I think, injections which are there, which are popular and which are doing their job, are PRP, what's known as platelet-rich plasma, and autologous chondrocyte implantation. So in PRP, what do? We take some of the patient's own blood, we centrifuge it, we get the platelet-rich plasma from his own blood. So that platelet-rich plasma basically contains all the growth factors and the healing factors, which we then inject into that area. So it's autologous, it's the patient's own blood. You take his own factors, concentrate the healing factors, and give it at that site where it's needed. And this seems to be taking the world by storm in the last 7 or 8 years. The other orthobiologic procedure is autologous chondrocyte implantation, and this has been in India for the last 10 years. This is basically for cartilage regeneration. So what we do is, we've got a chondral defect. This one's in the knee. We take a small little chondral biopsy, send it to the lab, grow the cells, the chondrocytes in the lab, get them back 3 to 4 weeks later, and then implant them with a fibrin glue at the defect site. And both of these have now been validated over many years to be successful treatments, especially for sportsmen. Finally, rehab. In any orthopedic injury, if you don't have the correct rehab, you're probably not going to land up with the requisite result. So this is one of our Mumbai Indians players. While attempting a spectacular save, and he saved that 4 runs, he lands up with a really bad injury to his right shoulder. And he takes a tumble there, dislocates his shoulder, and the whole thing pops out. He's a young guy, wants to get back quickly to sports. In a lot of these injuries, you land up with a tear. This is what a tear would look like. What do we do in these tears? So again, arthroscopically, we need to see it. So first, of course, you identify it. Once you've identified it, you need to repair it. To repair it, you require devices that are extremely strong. So these are suture anchors. These go into the bone. These sutures will then hold the tissue, bring it back to its position. So these, again, have revolutionized the way we treat our athletes. So once you've repaired it, you've got a good structural congruity there. To repair it, you also need certain instruments which will pass those sutures through the ligaments and through the tissues. And these need to be, again, extremely small but extremely strong. So this is one of those devices which passes that suture through. And with this procedure, which often lasts just about 45 minutes or so, you can get back structural congruity to that shoulder. But once you get back structural congruity, the really important part is the rehab. And the rehab involves ensuring that you get back range quickly, you get back strength quickly, you get back the ability to throw quickly. And when that rehab goes off well, then you know that that sportsman's going to do well. So he returned to his Caribbean Premier League match 6 months following his surgery. And he's on the tour to India. His first ball, competitive ball in India, he manages to take Rohit Sharma's wicket, unfortunately. So that's a good return after a bad injury in an elite athlete. And finally, sports biomechanics. So all of us, we deal with injuries, we deal with recovery from injuries, but it's ultimately understanding biomechanics which is going to ensure that someone gets back to their prime. And in 2014, we had a fast bowler, a very good upcoming fast bowler who landed up with a significant tear in his knee. And we, of course, had to repair that, but what we had to understand was his very abnormal biomechanics. Because if we restore anatomy and we restore function, but we don't restore his perfect biomechanics with that 15-degree hyperextension in that landing left knee, we know that we're not going to get back the same sort of effort that he's putting in. So understanding biomechanics is critical, understanding what exactly happens to each part of our body when we're doing a particular action. When we're bowling, what's the hand doing, what's the knee doing? And we know that in a fast bowler, this front foot, which contacts at about 15 degrees, but then goes into hyperextension. That hyperextension enables a fast bowler to throw that ball at a faster speed. So in that surgery, we need to make sure that he can get back that hyperextension, which really for all of us is abnormal. And when you do that surgery anatomically, do the rehab, and then work on biomechanics, we were sure that we'd get back his 15-degree hyperextension, which then enables him to become one of the best bowlers in the world. So, ladies and gentlemen, we've got strategies now that we can use to ensure that our elite athletes who have severe injuries are not debilitated from their sport, are not retired hurt from their sport, but have the means to get back and fulfill their destinies and become the champions that they have always dreamed of. Thank you.
Thank you, Doctor. You had an audience that was completely glued to you. And, do you know the reason why? One of the important reasons, of course, you're such a successful doctor. The other is, in a sports-crazy country, you are a hope for a nation. And so, everybody looks to people like you when any athletic event or a cricketing event, of course, cricket is a religion in our country, isn't it? So, when you showed some of those videos of some cricketers, I could see a lot of them actually looking around and saying, boy. And there are 2 World Cups coming, so I think people like you will have a lot to do to get everybody back to work. So thank you very much. That was really very, very informative, and congratulations. A lot of good work that's being done. And I think the challenge is not just in recovery. In a normal patient, it's just recovery and getting back to normal activity. Here's getting back into the highest level of activity and performance to perform and excel at a global stage. And that's what you are involved in. and that's a major challenge. You're doing such a good job. Thank you, Doctor. Thank you very much for that. May I now request Satya to come forward and hand over a token. Satya, if he's around.
Dr. Pardiwala, just a minute.
Oh, we've got one of the greatest doctors this country has produced, Dr. Nandu Lad. Give him a big ovation. It's a great honor, sir. It's a great honor. It's a great honor to have.
All of us in medical this feel very proud. And I can tell you, hearing him, I felt none of the Indian sportsmen need to go abroad. And now it will be reverse flow. The foreigners will come here. We are very proud of our products, and particularly Dr. Pardiwala, because he has devoted himself. Today in the commercial world, people want to make big money, but he has devoted. I just want to ask you that don't you think sometime people make a very high demand, and you have to explain to them that this is the line you cannot cross, because I saw something which is amazing. I am really impressed. Cartilage repair and cartilage restoration with regeneration. So I'm very impressed with it, but don't you think sometime, particularly the IPL business, they expect something which you feel, yes, thus far and no more?
Of course, I think in medicine, we're doctors, we're surgeons, we're not gods. There are going to be many conditions which are going to be way beyond us. And I think as surgeons, we try and do our best to ensure that we can restore anatomy first. I mean, that's something that you've taught us for so many years. So restore anatomy first, if you can. And in many situations, we can do that. Then get back the function with rehab, and then get back the biomechanics. And if all three go off well, then I think in many scenarios, you'll get that perfect outcome. But if any of them don't go off too well, then you'll get a suboptimal outcome. And although I think for all of us who are not elite athletes, a suboptimal outcome would be good enough, for an elite athlete, a suboptimal outcome is a complete failure. Because if he can't get back to his original level, and he can't be a world beater anymore, then he's defeated. And that means we've lost the race. So we're always trying to ensure that we can push the envelope a little further, try and get a little better, and try and make sure that each one of these guys gets back to their original level of sports.
Very proud of you, and you reminded me of my teacher, famous Dr. R.J. Katrak. And he gave me one message in life. He says, remember, in difficult situation, try to be godly, don't try to be God.
Absolutely.
And I think what you showed just now is absolutely godly appearance. I am very impressed, and I congratulate you. I'm very proud of you.
Thank you, sir.
Ladies and gentlemen, I wanted to bring both of them together because we have Padma Shri and Padma Bhushan Dr. Nandu Lad, who is considered to be the father of Indian orthopedics, talking to one of the emerging orthopedic surgeon. This means a lot, actually. Thank you very much. It was a wonderful presentation. Please come on the stage.
And as Satya does the honors to Dr. Pardiwala, the same thought was going through my mind. A person of the eminence and success, like Dr. Pardiwala, just mentioned to Dr. Lad, this is what you have taught us. Isn't it really gratifying to hear that? I mean, it's amazing. And yes, he is a father figure, Dr. Nandu Lad. It's a great honor to have, and the kind of work you're doing. And I think you summarized it in one word, saying that they need to get back to their levels of performance and be world beaters. That's the envelope that we try to push. Wonderful job. Thank you very much, Doctor.